Welcome back, everyone. It's great to be back with you for another deep dive.
Yeah.
Last time we really got into statins and how important glucose is for heart disease prevention. But today, we're going to zoom in on what all this means for anyone who's already had like a stent or bypass surgery. You might be surprised to learn that a lot of patients aren't getting the most up-to-date treatment
Absolutely.
based on the latest science. So this deep dive is all about giving you the knowledge you need.
Yeah, that's right. There is this misconception that stents or bypasses are a permanent fix, for heart problems, but the reality is a lot more complex than that.
It really is. It's like we think, okay, problem solved.
Right.
This source I was reading actually mentions how things have changed so much over the past few decades. Like a stent used to mean a really long hospital stay, and doctors had time to really emphasize lifestyle changes and ongoing care. Now it's often a same-day procedure.
Yeah, that's true.
It's amazing.
It's great for recovery.
Right.
But it can definitely give people a false sense of security. Just because you feel better and the technology is so much better, it doesn't mean your risk has just vanished.
Yeah. So takeaway number one, a stent or a bypass is not a get-out-of-jail-free card. You're still vulnerable.
Right. Exactly. The research is very clear on that. Even after these procedures, your risk for future events is higher than someone who's never had heart problems.
Than someone who hasn't had to go through these things.
Yeah.
That's why what they call secondary prevention is so important. It's everything you do after that initial event to stay healthy.
Yeah, it's a shift from reacting to being proactive.
I like that.
It's accepting that you have to manage this long term.
Right. So how do we actually do that? How do we take that and make it into something actionable?
Well, this source gets into some really interesting specifics. One that caught my eye was personalized dual antiplatelet therapy, or DIPT. What is that about?
So DIPT is basically standard practice after you have a stent put in. It's 2 medications that you take to prevent blood clots from forming inside the stent. But the key word here is personalized.
Okay, personalized. I'm intrigued. What makes it so personalized? Well, the source talks about how a lot of things actually come into play, like where is the stent placed? What's your individual risk of bleeding? Do you need other procedures down the line? All these things can determine how long you stay on DIPT and which specific medications are the best for you.
So it's not a one-size-fits-all?
Not at all. In fact, for some patients who are at really high risk, but who tolerate the meds, well, lifelong DIPT might be the best option.
Lifelong medication. Wow.
Yeah.
That really underscores how seriously we need to take this ongoing management.
It does. It's a reminder that it's a journey, not a destination.
Absolutely. And speaking of journeys, this source also takes us into the world of imaging technology. It mentions CT angiography.
Right.
And even cooler, they talk about this thing called the Carry Heart platform. It was developed by a company called Caristo in Oxford, and it actually assesses coronary inflammation.
Yeah. CT angiography is a great non-invasive tool for checking how the stent is functioning. Are there any blockages or narrowing? And you're right, the Carry Heart platform is cutting edge. It uses this thing called the Fat Attenuation Index, or FAI, to measure inflammation around the heart.
Okay, so help me understand this. Why is inflammation such a big deal?
You can think of inflammation like a fire smoldering in your arteries. Even if your stent is doing its job perfectly, that underlying inflammation can still drive heart disease.
So even if things look okay.
There could be a hidden problem.
Wow.
And that's what this technology lets us see. We can see that inflammation and treat it before it causes another event.
That is really incredible. It's like we can see not just if your stent is working, but if your body is still fighting this invisible battle.
Yeah, that's the power of this technology.
That's amazing. It really underscores why it's important to stay informed, talk to your doctor. They can help you understand all these new things and whether they're right for you. Which leads us to cardiac rehabilitation.
Yeah. This is an area that's been disrupted, especially post-COVID. But the benefits are undeniable.
Yeah, the benefits are huge.
Yeah.
This source really talks about how these programs have been shown to reduce the risk of future events. And it's not just about physical recovery.
Right. Cardiac rehab is multifaceted.
Right.
It combines structured exercise with education about heart health and lifestyle changes. It gives you the tools and knowledge you need to stay healthy.
It's like boot camp for your heart.
I like that analogy.
Yeah.
Like any good boot camp, it takes commitment, but the payoff is worth it.
So we've talked about procedures and ongoing monitoring and rehab. What about medication? That's got to be a big part of secondary prevention.
Absolutely. And one of the primary focuses of medication, especially after stents or bypass, is managing LDL cholesterol.
And this is where things get interesting. The source cites the 2023 NEC guidelines, which recommend even lower LDL cholesterol targets
Yeah.
than we used to think were necessary.
Yeah, that's right. Now we're talking about aiming for LDL levels below 1.8 millimole, which might mean higher doses of statins or additional medications for some people.
Like, what are some of those additional medications?
So a common one is ezetimibe. It works differently than statins, and it can really help lower LDL further when you use it in combination.
And they even mentioned PCSK9 inhibitors. What are those?
Those are a newer class of drugs. They can be really effective at lowering LDL. For people who can't reach their targets with statins and ezetimibe alone, they are given by injection. But thankfully, they're becoming more accessible through NHS funding for high-risk patients.
So there's a whole arsenal of weapons to fight high cholesterol, even if you've already had a procedure.
Exactly.
Wow.
But medication is only one piece of the puzzle. Lifestyle factors are huge, too.
Which brings us back to exercise. We touched on it with cardiac rehab.
Right. Regular physical activity is so important, both before and after a cardiac event.
And the source really stresses making exercise a long-term habit.
Yeah, and it doesn't have to be anything extreme. Just find something you enjoy and can stick with. Whether it's walking, swimming, dancing, gardening, whatever it is, just get moving.
And the benefits go way beyond just your heart, don't they?
Absolutely. Exercise helps with weight management, reduces stress, improves sleep, boosts your mood. It's a win-win.
And speaking of weight management, that's another crucial factor the source talks about, especially after a stent or bypass.
That's right.
Yeah, they specifically mention how BMI, body mass index, is being recognized as a major risk factor for more heart problems.
Yeah, and the research is clear. Losing weight, even a modest amount, can make a big difference. It reduces the risk of ending up back in the hospital and even lowers your chance of dying from heart disease.
So how do we tackle that? I mean, it can be so overwhelming, especially when you're recovering from a procedure.
Well, lifestyle changes are always the foundation. Diet and exercise, but the force also points out some exciting new therapies.
Oh, tell me more. New therapies are always fascinating.
Well, one category that's getting a lot of attention is GLP-1 agonists. They were originally developed for type 2 diabetes, but they've shown some really remarkable effects for weight loss.
I've heard of those. They're injections, though, right? That can be tough for some people.
They are injections, yes, but they're proven to be very safe and effective, and the weight loss can be pretty significant, often more than you'd see with just diet and exercise.
So it's like an extra tool in the toolbox.
Exactly.
When lifestyle changes aren't quite enough.
Yeah. And there's another group of meds that's really interesting, SGLT2 inhibitors.
Okay.
These were also initially for diabetes, but studies have shown that they can actually improve survival rates. In patients with coronary heart disease and a weakened heart muscle, we call that HFrEF. Basically, it means the heart's pumping ability is reduced.
Okay.
And what's even more amazing is these benefits have been seen even in people who don't have diabetes.
Wow, that's surprising. So they're doing something more than just controlling blood sugar.
It seems that way.
Yeah.
They appear to have a direct positive impact on the heart itself.
So we've got these new medications for weight loss and others that seem to protect the heart, even in non-diabetics. It feels like a whole new frontier.
I think that's a good way to put it, and it really comes back to something we've been talking about this whole time. The link between metabolic health and heart health. You can't separate them.
Yeah, you mentioned diabetes earlier, and that's another key point the source makes. Both diabetes and prediabetes are big risk factors for future events, including something called instant restenosis. That's when the stent itself gets blocked again.
Exactly.
Oh, wow.
And here's the challenge. We often see this. Cardiologists are focused on treating the immediate heart problem, while glucose management might be handled by a different specialist, like an endocrinologist or a primary care doctor.
So it's like everyone's looking at their own piece of the puzzle.
Yeah.
But nobody's putting the whole picture together.
Yeah, that's a great way to put it. It can definitely fall through the cracks, and that's why patient awareness is so important. If you have diabetes or prediabetes, even if you had a stent or bypass, you need to be proactive about your blood sugar.
What are some things people can do?
Well, the good news is lifestyle changes make a huge difference. Diet, exercise. But for a lot of people, medication is also necessary.
Okay, so we've got all these factors. Cholesterol, inflammation, exercise, weight, diabetes. It can feel like a lot.
I know it can be overwhelming. But that's why this concept of optimizing metabolic health is becoming so important in cardiology.
So break that down for me. What does that actually mean?
It means taking a holistic view. Instead of just treating individual risk factors in isolation, we're looking at the bigger picture, how your body processes energy, how your metabolism is working as a whole, and how all these things interact to impact your heart.
So we're moving from just treating symptoms to actually fine-tuning the whole system.
Exactly.
Yeah.
And there are some really cool new tools that are helping us do this, like continuous glucose monitoring CGM.
Oh yeah, those are the little sensors you wear, right?
Yeah.
That track your blood sugar all the time.
That's right. They give us amazing data about how your body responds to food, to exercise, to stress, even to sleep. And we can use this information to personalize your treatment plan, make adjustments in real time.
It's like having a personal health coach with you 24/7.
Kind of, yeah.
Yeah.
We also use metabolic testing to look at things like how well your body's using insulin, the function of your mitochondria. Those are the energy powerhouses of your cells, and other biomarkers that give us deeper insights into your metabolic health.
And you can use all this to create individual treatment plans.
Absolutely. And the exciting thing is, many of the treatments we've already talked about, like metformin GLP-1 agonists, SGLT2 inhibitors, they're proving to be very versatile. They can be used to manage diabetes, but also to optimize metabolic health in general.
It's like having a Swiss Army knife of treatments.
Great analogy.
Yeah.
The goal is to fine-tune your body's engine for the long haul.
I love that image. Fine-tuning your engine. It
Right.
really gets to the core of what we're talking about.
And it's not just about preventing future problems. It's about improving your overall health and quality of life.
So let's bring it back to our listener. What's the big takeaway from all of this?
The message is this. Having a stent or bypass isn't the finish line. It's the starting point for a new journey towards proactive, personalized heart health management.
And you have more control than you might think.
You do. By staying informed, being involved in your care, making healthy choices, you can have a huge impact on your long-term health.
Knowledge is power, right?
Mm.
And you, the listener, have the power to shape your future. So with all this information, what's one action our listener can take to be more proactive?
Yeah, that's a great question. After all this info, what's the one thing people can do to start taking charge of their heart health?
I'd say the most important thing is talk to your doctor. Yeah, just start that conversation.
It sounds so simple.
It is.
Yeah.
But bring what you've learned to your next appointment. Don't be afraid to ask about your risk factors or new treatments or anything we talked about. Remember, you're your own best advocate.
It really is about being a team. You and your doctor working together.
Exactly.
To come up with the best. It's about empowerment, taking control, creating a healthier future for yourself.
This has been such a fascinating deep dive. I feel like I've learned so much. I hope our listeners feel the same way.
It's a journey for sure. Heart health is a marathon, not a sprint. But with knowledge, with awareness, with support, we can all make progress.
Well said. Thank you for joining us today on this deep dive into life after stents and bypasses. We'll be back soon with another one, another fascinating look at the world of heart health.
Until then, stay curious, stay informed, and stay heart healthy.